name is Martina Big. You can see why. I have the biggest boobs in Europe, but I need my butt to match my boobs. I grew up in Germany. When I was a little girl, I was really shy. Even my teacher said, you need to get more friends, but mostly I played with my Barbies. I can remember I started thinking about, oh, you should be like Barbie when I was 11. I love Barbie because of her long, wavy blonde hairs, nice curves, the full lips, the small waist, the long legs, but her boobs are a little bit too boring. After high school, I was a flight attendant. Flight attendants can have breast surgery, but they must be very small. So I quit. In 2012, I changed my body from head to toe. There the life began. We had a rhinoplasty to slender the nose. I got porcelain veneers to get longer teeth for bright smile. This is my first implant set. I started with 32D. There's a port and there's a tube. And here's like a water balloon inside. And I have pumped up my boobs 18 times with saline. This is now 3,700 cc, about 9 pounds each. But because I had a liposuction to get long legs, my butt is a little bit too flat. I need really huge butt implants that I can control my size to grow bigger, bigger and bigger. As my name says, big is not big enough.
So the next patient is Martina. Martina has the largest pair of breast implants in all of Europe.
Those are huge.
So look how flat.
Oh, the poor girl, he has no butt.
She has anterior projection, but no posterior projection. So why don't we bring Martina in and go over this with her?
Can you please send a Martina?
Hello.
Martina? Dr. Nassif?
Yes. Hello.
Terry Dubrow, nice to meet you.
Yeah.
Hi, Michael, the boyfriend. Hi.
Terry Dubrow, nice to meet you.
Thank you.
Please have a seat.
Yeah. I traveled so far to meet the doctors to ask them, can I have really huge butt implants?
I like how you both have almost the same hair coloring.
Yes.
Yeah, when we met in school, we are a little bit like twins.
You met in school?
Yeah.
Yes, we was senior at high school, and since we are a couple.
You knew
Since
each other
high school?
Yes, since high school.
That long, no kidding. That's
And
very
when
nice.
we worked for the same airline, and now we are also partner in business and in life.
Wait, but you work for the same airline.
Yes, I was a pilot, and Martina was a flight attendant.
So what is the name you go by in Germany?
Martina Big.
Martina Big.
Yeah.
So big.
Because big is not big enough.
Right. You have 2,000 in there?
No.
What do you have?
3,700.
In each?
Yes.
3,700 in each?
Yes.
Those breasts are ginormous. How could you even walk without toppling over?
How many operations did it take you
One
to get?
surgery and the rest is fill-ups. Here's a valve and there's a valve.
Oh, so you have a tissue expander in
Yeah.
there. So you have a little port and a valve that someone puts a needle in and puts more in?
Yes.
Tissue expanders are very safe to use in the short term, particularly in breast reconstruction. They are absolutely not meant to be used in the long term, and if you do so, they could expose you to the risk of losing both of your breasts. Okay, so tell me what's been going on with your buttock area. What are your goals?
In 2012,
Yeah.
I first had a liposuction to got from here up to the knees.
Okay.
But now I want to have butt implants to create the
A real S-curve.
So about as
Yeah.
big as your breast sticking out, not that big. How big?
1,500 maybe a little bit.
So you want 1,500 cc's per cheek.
Yeah. I know I have to start with a smaller size because the healing of the surgery, and then I can grow more and more and go to the really extreme sizes step by step.
So when you first had the liposuction, did they talk to you about putting the fat in your buttock?
No, we were at that point. I only want to go really slim.
The fat is too soft. We prefer more the firmness of implants, the rounder.
Right, you want more projection straight back.
Yeah.
Yes,
rather
that's
than
correct.
wide.
Yeah.
right?
Absolutely. I like a big curvy butt expand straight in the back. I like very much.
Let's go into the exam room, take a careful look, and see whether it's something that's possible. You know? Okay?
Yeah.
Does that sound good?
Yes.
Come on out.
Clearly, we're not going to put tissue expanders in Martina's buttocks, but because she came all the way from Germany, I want to see if there's anything we can do to help her. Okay, so you had liposuction done where? Here?
From here.
Everything. Inner thighs, outer thighs, tummy, everything. Did they do the flanks too? This area?
Yeah.
So you have no fat. Let's look at your buttock area. Do you know how many cc's of fat they suctioned from you?
4,400.
Oh, well, you know
That
what?
would've been great if it went in
That
the
would have
butt.
been fabulous. That would have given you a really nice bubble butt. That would have not been a problem. It would have been stable. It would have worked. It's too bad the surgeon who did the liposuction didn't take some of that fat and inject it into her buttock area, because that's the best and safest way to get a large buttock projection. What you're asking for is this expandable implant put in here. It's an interesting idea and it has worked for you here, but there are several reasons why this area is not exactly the same as this area. So I want to show you something, okay? But first I want you to change into your pantyhose so we can put some implants in and show you what we're talking about, okay? Sometimes just telling a patient a procedure is a bad idea isn't enough. You have to show them. Now go ahead and sit down.
When we are going to sit to the chair, how it works. Oh, whoa, okay. Maybe it doesn't work. A little bit. Oh. Whoa, it's a little bit too much.
It's a little bit too much, right?
Yeah. Sitting on saline implants is sitting like on a rock.
What?
I'm just brushing something.
What's wrong?
There's something wet.
When did it pop?
Just
It's popped. See, it's already popped with just this amount. This is why this particular surgery is a really bad idea. So we think it's not a great idea. What do you think?
yeah, I think you are right. The fantasy is not real life.
The fantasy is not real.
Okay.
The fantasy is not real. There we go.
When I came, I hoped to get real huge surgery for extreme look. Now I am more realistic to get curvy look, but not that extreme that I thought before.
Pleasure.
Thank you.
Pleasure meeting you.
Thank you very
meeting.
much.
Thank you.
I'm Martina Big, and I'm back again, and now I'm black. Last time I met Dr. Nassif and Dr. Dubrow for getting really big expandable butt implants. They told me expandable butt implants in this size are not possible. I was a little bit disappointed, but I'm still working on it in Germany. I was at the consultation for a butt implant. We came off topic about tanning, and for a long time I wished me tanned skin because I've never had summer tan. I was too pale. Then he told me he knows a colleague who's doing a test. It's a new medicine to get a little bit summer shade. The doctor gave me 3 injections in my belly. The medicine started getting me tanned from the first weeks. Every 2 weeks I had to change my makeup because much darker. And in the course of time, wow, it's so fascinating. Also, my eye color changed, my eyebrow color changed, and also the hair color itself. I'm really proud that it works for me so well, and so I decided to support my body to going a really African girl. I bought a wig, black curlies. When I posted the picture, my social media exploded. In 3 days, I got 7 million reactions. At first, they thought she's joking. No, I don't want to joke. I love the black skin and the black features, and so we have to go for lip injections very often to keep up my African style. And now I'm really excited to see the doctors again because I want to ask them to do a nose job for me to look more African style. Also, we're happy that Mama Nature and this new treatment and me work together as a team.
Oh, it's so beautiful here. What do you think?
Oh yeah.
I like the sun.
lot of sun for a lot of color.
We both have the same treatments, the same, and for you it works so well, but for me it works, but not so good.
Michael and I got the treatment at the same day. He said having more tan is really good because Michael is a blonde boy with blue eyes, and in the past 5 minutes out without sun cream and he's really, really red. Can you help me with my shoulders?
Yes. Martina and I love it to be tanned very much. And if we go in the sun for a short time, it goes very fast, much darker. This evening you will darker again.
Yeah.
If the people see you, they all think that you are an African girl.
Yeah, it's so funny.
Do you know at
When
the African shop? When you go inside the African shop and you tell I'm not African, I am born as a white girl, they say, oh, Stab, that is not possible.
Being black, it's not a costume. I hope it will last up to the end of my life because now I have a lot of friends in the black community.
I'm so excited about the appointment tomorrow. Do you think Dr. Dubrow and Dr. Nassif will remember you?
No. When I was last time there, I was really white and much smaller. Maybe.
Yes, the breasts were also much smaller.
I think I will be really, really happy if they can work out the nose. I think I need a nose like...
Martina was every time a beautiful girl, but now Martina has become a dream girl. I hope that Martina will achieve her African look. I hope it so much. It's so beautiful.
The
Yes.
journey is the goal.
Yes, I think you become from more to much and you become more beautiful.
Michael, he's more in love with me? No. In compared to the past. Shall I remove the hair?
No, it's good. And one together. Good?
Wait, that's so.
So, okay.
I'm proud to be black, yeah? It's beautiful.
So beautiful pics.
Yeah,
Our next patient is Martina Big. She came before, she had very large breast implants, but she wanted to match her buttock to her breast. She wanted more buttock projection. We successfully advised her against
Not to do it.
Right. Martina is back. So she wants to see you now about the possibility of doing something to her nose. I follow her on social media. Since we've seen her last, she's made a few changes.
So let me guess, she didn't listen to what we said.
See whether you can pick up some of those changes, okay? So why don't you bring Martina and Michael in?
Can you please send in Martina and Michael?
Good morning.
Hello.
Nice to see you again. Yeah, we met last year. I was a white girl with blonde hair. I changed meanwhile from a white woman to a black woman, to an African look.
By the way, just say it.
What?
Paul is completely dumbfounded. I'm used to him being dumb, but not so dumbfounded.
This is no fake, it's a new medicine.
No, it's not. No, this is not.
This is real.
medicine.
This is melanotan.
No,
Well,
it's
it's a relative of that. It's an MSH stimulator.
You actually just changed you're serious.
Anyway, it's great to see you. Let's talk. Have a seat. Let's talk about this.
Thanks.
Is this amazing?
The doctors are very professional, but to shock Dr. Nassif so, it is a sign that Martina's change is really hard.
You had. Are you okay? Can you handle this?
Hold on. Did you really? This is real?
This is real.
There's actually.
Give me some
hold on.
oil.
This is real pigment. They injected this in you, yes?
Yeah, in the
They
belly.
gave you an injection.
In the belly.
One injection?
3.
So you've had 3 treatments.
Yep.
I had the same treatment, but for me it don't work so well. It's still in approval. It's
So it's in a testing phase.
yes.
These drugs have been around for years. You inject it, it stimulates MSH, melanocyte stimulating hormone, to increase melanin production from melanocytes. When you inject melanotan into the body, it stimulates all the pigment-producing cells in your body, wherever they are, in your eyes, your skin, your hair, to produce more dark pigment. So the drug I'm familiar with, in this country it's illegal. You can't even experiment with it. These drugs are very dangerous. Have you had any side effects?
No,
Did you throw up?
it didn't.
Do you have any joint pain? pain in your... No pain?
Was this one of the complications described that you would go this dark?
Her melanocytes are turned on. They're upregulated.
Okay, but are they going to downregulate or is this it now?
No, this is reversible, right?
Because the drug is new, he can't say the exactly period how long it works.
But I want to go again because I like it. It's not a complication. I don't think I'm going to wake up and going, oh, now I need to go back very soon. No, I'm going to stay black.
As a doctor, darker skin is better skin because it's better designed to protect you from the sun. So do you plan on staying this color? Do you like this? You want to be this way for the rest of your life?
Yeah, that's why I'm here for changing my nose.
How many nasal surgeries have you had?
Only one.
Yeah.
You had one.
For a smaller nose, it was in the past.
What exactly do you want to do with it?
A little bit wider, a little bit like this, but this is too much.
So you want to take your tip, push it in, and make your nostrils also wider?
A little bit, yeah. In autumn, I'm going to visit Namibia to learn more about the cultures of the Africans.
Do you want to learn more about the real African people?
Are you guys married?
No, we are still preparing.
Do you guys plan on having children?
This is a interesting question.
This is a difficult term.
A lot of people ask
because the people are talking, will the children white or black? And
Martina, Michael, let me tell you something. No matter what color your skin is right now, your DNA, your chromosomes are not dark.
There are no medicine to have effect on the DNA?
No.
No?
No, and you don't want to, wait a minute, you don't want to do anything like that.
You change your DNA, that's how you get cancers and immunology problems. But anyway, don't worry about that. You're not changing your DNA.
Let's get you in the room and let's examine you.
Yeah.
We'll examine your skin, we'll examine your nose, and we'll go from there.
That's a good idea.
That's good to hear. This is an opportunity for us to examine Martina and Michael. They got themselves involved in a crazy experiment. Now it's our job, our duty as doctors to make sure they're okay. Wow, look at you too. You guys are almost the same color. Michael, did you gain a little bit more weight since last time we saw you?
Yes, a little bit more.
A little too much schnitzel.
Here, come on.
Yeah, so let's look at Michael first. So all of these moles, Michael, they've gotten darker? Yes.
Okay, so they did become darker. So you need to go to a dermatologist when you get back to Germany. I mean, when you have a mole and it turns dark, that could be a sign that you may have a melanoma. So if you have a mole that starts turning dark, go have it checked. So when I hear of someone turning themselves dark, I'm wondering, can that take their moles and make them cancerous? Put your head back for me. Let me just take a quick peek. Septum is straight. Well, actually, no, it's not. You have a deviated septum all the way over to the left. Okay, turn your head that way. So your nose is really over-rotated. Martina has legitimate issues with her nose. Her nose is over-rotated and she's got a deviated septum. She is actually a candidate for a revision rhinoplasty. What's interesting is you did have an over-aggressive rhinoplasty, which is something that I always fix. What that would entail would be me taking cartilage, most likely from your rib, and I need one here, here, here to lower it, and something here. This is all doable. I can fix your nose, make it look a little bit less pinched, and lower it a little bit, which will not give you that look you want. But for me to do what you want, I have to go the extra mile. When patients come and they want us to change them, let's say they want to go from a male to a female, they go through a process, and they make sure in their life with doctors' help that that's really what they want to do.
Yeah, it's not the costume.
We would feel better if you lived with this skin for a good couple of years. Martina has issues that I can fix, and I want to help her. But at the same point, it's irresponsible of me to do what she wants right now. I really want Martina to wait before she makes a decision like this, because one thing, we don't know how long this crazy experiment is going to last. This is possibly reversible. Once I make a change here, it's done. Live with this for a little while. Are you okay with that then?
Yeah.
You're not going to go to Germany and have someone else do it right now?
Yeah, I'm just learning about collecting information. I like the doctor's advice. I will take my time to learn more about my new self.
Well, listen, good luck with everything. You go see a dermatologist when you get there.
Thank you for coming in.
Safety first.
Safety first.
Very good. Thank you.
There you go.